Good morning, everyone. Good morning. So great to see everyone here. I'm excited to welcome you all to our annual New England Hymns Spring Conference this year. I think I've met a good majority of you in the room, but for those who haven't met me, my name's Katie Bethel. I'm the current New England Hymns chapter president for this year. Actually, only three more weeks before Renee steps in. So I'm curious to know where everyone came from today. So raise your hand if you came from Massachusetts. Majority. Connecticut? Rhode Island? New Hampshire? No? Okay, yep. Vermont? Okay, we got representation across all 6 states. Awesome. Oh, and Maine, oh my gosh, one of my favorites. Sorry about that. Maine, and we got Liddy, how could I forget? Liddy's on our executive board. Oh man, that's one less drink for me tonight, so. So I want to thank you all for making the trip here today. I also want to welcome the members and the non-members that we have here. We have some first-timers as well. They have a little red pink dot on their badge. So welcome. Please come by our membership table or approach any of us if you'd like to learn a little bit more about the organization and how you can volunteer if you're interested. We have a wonderful lineup of speakers for today. We'll start with our opening keynote very shortly. And then the wall will come down right here, right where I am actually, and we'll divide the room into 2 different tracks. Digital transformation on this side, clinical informatics on this side. So you'll see the wall come down and go up a few times today, but during the tracks, this wall will be down. So just want to direct everyone to where to go. So I'm really excited to recognize some of our long-term sponsors that we have here today. Without our sponsors, we would not be able to put on events like this. They are seriously what makes us tick and what makes us be able to do all these great events for throughout the year. So we have our 5+ year sponsors with red ribbons on their badges and 10+ year sponsors with gold ribbons. So if you do see them, please thank them for their sponsorship. And please help me to congratulate the following sponsor companies. If you're in this room, please raise your hand or stand up. For the 5+ years, we have InterSystems. They're probably out there. Cloudwave, anyone here? I know they're all out there, and Zerto. And then for 10+ years, we have Connection, we have Wolf & Company, and we have Queen Consulting Group, which I see my 2 colleagues right back there. So please remember to visit all of the sponsor booths today and thank them for their sponsorship. So I'm also very excited to share that we'll be holding a student poster contest this morning from 9:30 to 10:30 that is on the agenda. That is with the help of our Student Activities Committee and our Past Presidents Club. We had 47 New England Graduate School Health Informatics student posters that were submitted, and only 3 are here today that are going to be presenting for a winning cash prize. So if you would like to attend that, they're actually, it's at 9:30, right in the Lennox room, right over there. And speaking of winners, we will also be announcing this year's E-Ink Scholarship winner. We'll be announcing that during the closing remarks at 4:45 today. So thank you to E-Ink, who is our scholarship sponsor again this year, and all of our scholarship committee and the work that you did to make that happen. And we'll be announcing our winner at the closing remarks. On each table, there are 4 QR codes. I just wanted to highlight that. We have the agenda for the day. We have the conference survey, so by completing that survey that you see there, you'll be entered in for a chance to win a $100 Amazon gift card. We'd love to hear your feedback on what you liked about today, what you didn't like, what we could be doing better. And we'll announce that winner at the closing remarks at 4:45 as well. The membership survey is also another QR code on there. By completing this survey, you'll be eligible to win potentially a $50 Amazon gift card. We'll be drawing that and announcing the winner later on today, also at our closing remarks. And then the 4th QR code that you'll see is our charity donation. So New England Hymns has donated to 4 Children's Miracle Network hospitals across New England. So we've donated to Connecticut Children's, Hasbro Children's, Northern Light Eastern Maine Medical Center, and Boston Children's. So if you would also like to make a donation, we wanted to provide that QR code for you there as well. I also wanted to take a minute, just a few more thank yous, because a lot goes into to make this day possible. So thank you to our volunteers, our members who have made today, I should say, possible. It's really a team effort, and between all of our committees, student activities, marketing and communications, programs, past presidents, clinical informatics, diversity and equity inclusion, those are all some of our committees that we have here today that really did a lot to make this day possible. Thank you to our Administrative Director, Elisa Pelchat, for all of her work leading up to this. I know it's not easy, and every little detail is picked out perfectly, so thank you, Elisa. And then thank you all for being here today and making the start of the conference great. So with that, I'd like to welcome and do some opening remarks for our opening keynote for today. So our opening keynote for our conference, titled Charting the Path to Digital Transformation: What to Do Now, What to Avoid in the Future, and How to Prepare for the Major Health Technologies of Tomorrow, presented by our own incoming New England Himss President, Renee Broadbent, MBA CCSFP Chief Information Officer of SoNE Health, and Bret Anderson, Principal at the Chartis Group. So Renee is a senior-level healthcare executive with extensive background in strategic planning, information technology, population health management, and data security. Bret Anderson is a principal with Chartis, over 15 years of experience in the healthcare industry. At Chartis, he has advised academic medical centers, community hospitals, specialty providers, and accountable care organizations on enterprise and digital health strategy, population health management, precision medicine initiatives, and institutional affiliations. Please join me in welcoming Renee and Bret today.
Thank you, everybody, for joining us again today. This is going to be a great event. Just move this out of the way. Actually, I'm just going to speak very briefly because you'll want to see this awesome presentation by Bret. But just to give you a little background, about 10 months ago, I work at Southern New England Healthcare Organization, or SoNE Health. As part of our strategy for 2023, we wanted to do a digital strategy for now and in the future. And knowing in advance this was going to be a heavy lift, we decided that we needed some outside help to guide us in that journey. Through the course of last summer in our strategic advisory group, as well as our board, we interviewed multiple consulting companies, had them come in and present, had them do client stories, and at the end of that, we decided that the Chartis Group was an appropriate choice for us based on their experience and their knowledge, and we're very happy we did. We ended up with a great strategy. We have a great governance process where I am, and we were able to go through a very intense 3-month period where we had work groups, interviews, workshops, and data analysis to really look at our clinically integrated network as a whole. And we were very inclusive of not only our employed physicians, but our independent physicians, as well as our Trinity executives in Livonia, as well as our local Trinity management on the ground. So we really tried to cover everybody and get everybody's perspective, as well as integrate best practice across our clinically integrated network. We ended up with an amazing strategy that we're looking to execute. I think it's really important when you hear today that you realize the work that has to go into this, that it's not a develop it and then implement it, it's a multi-year strategy, and it has to evolve with time. The good thing that we got out of our strategy is we have some short and longer term deliverables that we can execute on and progress that process. The last thing I'm going to say before Bret comes up is that one of the biggest things that we did in the development of our strategy is have a lens with equity. Right now, we know that there's great disparities on how healthcare is delivered across many populations. We want to solve that issue as part of our delivery in our healthcare. It's really important. It impacts the overall health care of everybody across, and it's, in my opinion, it is a right to have access to good health care and to be well. So with that, I'd like to introduce my colleague again today, Bret Anderson from the Chartis Group.
Good morning, everybody. Thank you for having me. I'm really delighted to be here and talk about a very important topic that's probably on everybody's mind in some way, shape, or form, and that's digital transformation. Today's presentation, I think, is going to be really a summary of some of the most compelling lessons that we've learned while working with dozens and close to 100 at this point, different organizations, both domestically and abroad, on what their digital transformation journey is trying to accomplish. I hope you leave here today with a better understanding of what digital transformation is all about, what you can do at your organization to get that journey started, and how it's going to be impacting healthcare for the foreseeable future. So with that, let's go ahead and get started. Today's presentation is going to be divided into 4 different chapters with time built in the end for some questions. We'll start with an overview of the macro forces that are bringing digital health and transformation to the forefront of so many different strategic discussions today, and take a look at what a case study with SoNE has looked like in the application of some of those transformational imperatives. We'll then review the critical elements of digital transformation and, perhaps more importantly, figure out what exactly the big potholes are, the things that you need to avoid along the way. And finally, we'll cover a very buzzworthy topic, which is artificial intelligence, and how digital transformation is helping organizations prepare for that exciting technology now and in the future. By way of introductions, I'm Bret Anderson. You probably heard a little bit about my background. I have a primary focus in digital transformation and digital health strategies over the last decade that I've been at Chartis. And that experience has taken me across the country and in many instances across the globe. I've worked with a number of different academic health systems, clinically integrated networks like SoNE, medical groups, community hospitals, integrated delivery networks, as well as government organizations. One of the logos you may not recognize down there on the bottom of the right-hand side of the slide is actually the Department of Health of Abu Dhabi. One of the major global projects at Chartis was started back in 2017 before the pandemic, where we built what is still today the largest public health information exchange in the world. I'm pretty proud of that one in particular because in the wake of the pandemic, the United Arab Emirates has actually had one of the highest vaccinations, highest per capita vaccination rates in the country, and they credit a lot of that with the health information exchange that we are helping them set up. I'd also note that there are a number of different organizations that we've helped in different ways. There's the University of Chicago that we helped with digital access strategies. There is Northwestern Medicine in helping them reduce the documentation burden on their provider staff. And then there's the more value-based digital strategy that we developed for Beth Israel Deaconess here in Boston. And finally, I'll note that I have no material interests or any sort of involvement with any of the organizations that I have worked with previously, nor do I have any material interests with the vendors. So I always like to put that in kind of the front of the presentations. And before we look at the macro forces in digital health in the first chapter of the presentation today, I wanted to share a little bit about what the Chartis Group is all about. We probably worked with some of you here in the room, but for those that we haven't, we are the largest advisory firm that's solely dedicated to healthcare. It's simply all we do, and I would venture to say that we know it better than anybody else in the consulting world. Our areas of expertise span a wide range within healthcare, from performance operations to strategic planning to digital and IT infrastructure planning. We also have dedicated groups that focus on payer advisory and revenue cycle and private equity consulting. And behind those practices, we also have specialists in health equity, as well as change leadership and communications to accentuate those different adjacent services. So together, these areas of expertise give us really the insight and the foundational knowledge base to assist with solving nearly any problem in healthcare. And how that's manifested into the client work that we do, a reflection of the deep level of expertise that we have, and we bring a profound impact to our clients, is reflected, I think, best in our class ratings. 3 years running now, we are the #1 management consulting firm in healthcare. We're also ranked #1 in digital transformation consulting, which is another feat that we've been holding on to for the last 3 years. I think that we take immense pride in that sort of positive feedback that we get from our clients like SoNE. And I think it's also a reflection of the credibility that we bring to the table to help health systems along in their digital transformation journeys. So now let's begin at, the presentation and more of the substantive review of the major driving forces behind digital transformation. Starting here, we first see some of the context regarding what the new normal is looking like for many different provider organizations and the concurrent pressures that they are trying to navigate through. So to summarize all that is here on the slide, first, I'd say that there's immense margin pressure for a variety of reasons, including shrinking or stagnant reimbursement, the immense growth in labor costs, and the inflation overall that's increasing the cost of capital. And this isn't just a challenge for small community or rural hospitals, but it is hitting the bottom lines of nearly every provider organization we work with. Secondly, the growth of value-based care, and especially Medicare Advantage, has been a major trend across geographies. In much of New England, for example, over half of the Medicare beneficiaries are now covered under Medicare Advantage, and we expect that number to grow. Third, there's been a tremendous shift in the site of care. Before COVID, there was already a migration from the inpatient to the outpatient setting underway, and we still expect that to continue for the foreseeable future. But we're also seeing shifts concurrently from in-person to virtual care, and right now we're seeing about 10% or so of all outpatient clinic visits being done in the virtual space. Additionally, we're seeing the trend towards care at the home, where a growing number of patients that would otherwise be occupying inpatient beds are instead transitioning into the home care setting and freeing up those acute care resources for higher acuity patients. And finally, there's the ongoing workforce challenges plaguing so many different provider organizations, much of which has been focused on hospitals in the wake of the pandemic. However, I'd say that the aging demographics that we're seeing across the board, that puts a lot more of our healthcare workforce into the retirement years. We simply don't have the backfill numbers to come in behind that. So together, these concurrent challenges are forcing provider organizations to consider more innovative solutions to these seemingly intractable problems. It simply won't be sustainable to stay on the path that we're on right now. There needs to be fundamental shifts in how healthcare is delivered, how it's managed, and that's where digital can play an increasingly impactful role to solve those equations. And those equations are only getting more complex. In addition to the pressures that we just discussed on the previous page, there's been an effort to build upon the infrastructure and the operations that were designed for a much different imperative. The legacy care processes and the archaic IT infrastructure that many provider organizations deal with are simply not designed to easily integrate with modern, digitally forward care models. And the strategies that provider organizations adopt to address these challenges must consider not only the new technology, but also thinking about what they need to abandon for those that are becoming obsolete. And that's really where digital transformation is all about. It's one, improving the delivery of care within the current care settings. Two, it's identifying the pathways and protocols that are no longer serving the needs of patients and providers. And three, it's determining what the future optimal care pathways are going to look like and what role digital should play in carrying those out. But in order to achieve that promise of digital health, to improve the care that's being delivered right now, to abandon the care that's becoming quickly obsolete, and to prepare for those new care pathways for tomorrow, there needs to be a fundamental merging of the perspectives of healthcare systems and the patients that they serve. From the traditional health system executive's perspective and viewpoint, the hub is where most of the care has been historically delivered. That perspective has manifested itself into the expansion of brick and mortar sites that maintain an imperative to feed the hub, to get heads in beds. And while that strategy may have won in years past, it's not aligned with a more consumer-oriented view that we'll see on the next page. Contrasting with the previous page in the health system executive's perspective, we see that healthcare consumers often think of the tertiary hospital as last in their destinations and of where to consider going for their care. They first resort to Dr. Google to research their symptoms, find the closest care, and they often resort to the old-fashioned phone line when they're trying to reach out for care, oftentimes, getting bounced around between operators and different switchboards. And it's rarely the local or tertiary hub hospital that they find the most convenient place to access their care. The bottom line here is that compared to the traditional health system executive's view, their customers, the patients themselves, value convenience and access to care across the continuum as the imperative, not filling the hub. And meeting consumers where they are and where they want to get their care is now the new imperative for health system executives across the board. So why does this disconnect between the perspectives of health system executives and patients really matter? Quite frankly, because the stakes of that disconnect have never been higher. Staying on the digital sidelines puts several of our strategic pillars at risk. First, it's critical, I think, to recognize that the large majority of patients out there are now willing to switch providers if they are unable to access their care, or even if they are, if the experience is terrible, they'll switch still. And to put some hard dollars against that risk, each patient has around a $1.5 million value from the services that they are likely to need across their lifetime. And the value for a family is even larger. And keeping those patients loyal to a provider organization is tremendously important, given that the cost to attract a new patient is typically 5 times more expensive than it is to keep the ones that you already have a relationship with. And compounding this churn in patients is the second and concurrent issue you see on the right hand of the slide, and that's dealing with the workforce crisis and the shrinking roles of providers to offer access to those services. We've all heard about the burnout numbers, especially in the wake of the pandemic. While those may be slightly improving in recent data that I've seen, it's still a chronic issue. The labor costs are still extraordinarily high, and the problem simply hasn't been solved. So health systems recognize that there's a lot at stake, but I'd also say that they're not the only ones to do so. A couple of things that I'd like to note and share with the group here. Last year, Chartis partnered with Himss, more of the national organization based out of Chicago, and we conducted a survey of health system executives from across the country. A couple things to note from that survey is that there is simply no shortage of digital health supporters among hospital and health system leaders across the United States. And in fact, almost 100% of them thought that digital transformation is critical, but we also found that less than a quarter of them are actively implementing digital health strategies. Additionally, many of them feel as though they're falling behind new market rivals that you see on the right-hand part of the page that are increasingly bringing digital forward experiences to their care offerings. You've probably seen the One Medicals, now Amazon Care, the Carbon Health, Oak Street. They're populating all over New England as well as across the country, and that's not going to be subsiding anytime soon, too. I think this finding is particularly important given the immense relevance to New England and the transition that we're seeing, especially on the Medicare Advantage side of things. A lot of these new startups that are very digitally oriented and consumer oriented are trying to grab as many Medicare Advantage beneficiaries, and they're making money hand over fist in doing so. A lot of our client organizations are seeing this happening in their market, and I'd advise that if there's one patient cohort that they really need to go after, but do it in so much of a digitally oriented and consumer oriented fashion, it's probably in the Medicare Advantage space. But it's not just that. You're seeing a different set of market rivals. You're seeing retail providers and large tech companies come into play. And there's an increasing perception that they are becoming as much of a competitive rival as the traditional healthcare systems. So I think that overall, it's a challenging environment, and more than ever, traditional healthcare providers are being disrupted in new ways, and they simply can't afford to be digital laggards anymore. So underscoring that point is that the impact that digital can have on so many different stakeholder groups. The results from that same Chartis and Himss survey revealed that digitally transformed experiences are important to, one, attracting new patient consumers with a compelling digital ecosystem of engagement, retaining existing patient consumers with digital features like personalized communications and wraparound services to serve their totality of care needs. 3 is to gain loyalty from referring physicians and give them basically a digital easy button to send their referrals in a convenient and timely manner. 4th is engaging with employers who are increasingly wanting to go straight to providers to care for their workforce needs. And 5th is to enter new markets with telehealth, with remote patient monitoring, and virtual consult programs that reach across geographies. And on this next page, it's not just the perception of digital transformation to drive value, but we've actually got the data to back it up. We have here some common levers of concrete value that digital can uniquely pull for provider organizations. First is the ability to better attract and retain patients, which often has the biggest financial impact for the organization. You know, as we mentioned before, there's a critical mass of patients that are willing to switch providers, and having a digital ecosystem for them to be attracted and retained within is now becoming table stakes in many regards. Next is the ability to efficiently manage the health of those patient populations that you serve. Digital can help reduce avoidable ED visits and readmissions better than traditional analog-based approaches that often make the patient feel disconnected from their provider and unaware of the different types of care resources at their fingertips. And finally, we're seeing digital as a key avenue to reach under-resourced communities and provide greater access, affordability, and trust with their providers. A recent study, for example, showed that digital health can help close racial disparities through greater onboarding of underserved communities and ramping up their use of primary and preventive care. So all told, the value that can be generated from digital transformation, I think, is immense. And these imperatives to attract and retain patients, to better manage them when a relationship has been established, and to widen the aperture of access to traditionally underserved communities, these are all imperatives that we need to be embracing in a value-based and health equity-focused world we now live in. And dovetailing off that last theme on reaching underserved populations, digital is becoming really, I think, a critical tool to enhance health equity. It's doing that on 4 different major fronts. The first is on the provider side of things that you see there on the left side of the page. It's leveraging digital solutions to capture data on diverse patient populations to uncover previously unknown sources of health disparities. Secondly, it's also about using digital tools to train the healthcare workforce to deliver more culturally competent care. Transitioning to the right side of the slide, on the consumer-facing side, it's about developing new and innovative digital access points that have historically been challenging for some of the patients to utilize. And secondly, it's about boosting health literacy across patient groups, regardless of their language, their education level, or cognitive backgrounds. So overall, I think the best way to look at digital through the health equity lens that Renee was talking about a few minutes ago is to not get overwhelmed by the challenges or the digital divides, but instead see the digital opportunities and the imperatives to reach those patients that our traditional and analog methods of care delivery have largely left on the sidelines. So this perspective of being digitally opportunistic and advancing health equity is precisely the mindset that we embraced with SoNE. Our engagement earlier this year that Renee just talked about, we looked at a variety of different opportunities to better engage our patients and some quick wins to leverage digital as a way to advance their journey on health equity. One of the approaches that I'd encourage every health system to be doing is to implement existing technology to reach those diverse patient groups. For example, showing patients how to use Google Translate on your homepage or your patient portal is an easy step in that direction. Developing guides for mobile device access for care for the hearing or visually impaired is another way that's incredibly impactful for those patients with such challenges. And as our overall population ages, these features are going to be increasingly utilized and will likely become even more useful as sophisticated technology like AI is introduced. We'll talk about that in a few minutes towards the latter part of this presentation. But I think the takeaway point is that there are tools and technologies that you can use today without buying a thing that will be meaningful for your patients and enable you to better engage with them for the foreseeable future. So zooming out on the health equity focus of our engagement with SoNE earlier this year, I wanted to share with everybody the broader context of that work. I think it's really a great reflection of what successful digital transformation planning should look like, and many of the conclusions that we came through the work with SoNE, I think are lessons that are widely applied across the provider landscape. So earlier this year, Renee and her team engaged us at Chartis to develop a 5-year strategic plan for the organization. And after conducting over 30 interviews of different key stakeholder groups, really to understand what the current state of play is within Southern New England, we came to a few overarching conclusions. The first is that with the aging and increasingly diverse population that they serve, that the care delivery model had to be fundamentally transformed. Second is that data would be the lifeblood for informing decisions on who and how to engage with patients and providers within the network. Third is that population health management is a critical success factor for the organization, both from a mission-based and financially based perspective. And fourth is that the network connectivity between providers within SoNE had to be bolstered to make care coordination and patient retention as easy as possible. So one of the things before I transition from this page is that you'll notice that these imperatives are not necessarily digital in nature. That's specifically by design. They are strategic imperatives that digital transformation would seek to achieve, and that's a theme that's going to remain common throughout the rest of the presentation. So how did we translate those imperatives into digital initiatives to transform the organization? Well, those are laid out here, and the first way, when we're thinking about the way in which we can transform the care model, we really had to revamp the way that patients are engaged to be more proactive, to be more data-driven, and integrated with new delivery innovations like mobile care in the home. Secondly is building data reports that can be immediately translated into action, like identifying which patients are due for an annual wellness visit and which ones are at risk for attribution with another network. It's about deploying a 24/7 virtual triage service that leverages AI technology to minimize avoidable ED visits and inpatient stays. And it's about establishing a referral portal, what we call the digital stage door, for easy access for network providers to send their referrals. So together, these initiatives are what SoNE is busy working on today, and I think is going to position them for success in the future to meet those different strategic imperatives. And now that we've seen what digital transformation looks like, what's bringing it to the fore, you may be thinking to yourself, yeah, I get all that. I understand the forces. I understand the potholes. I understand what it may look like in the SoNE context. But you could still be thinking to yourself, what is digital transformation broadly speaking? So how we think about it at Chartis is basically leveraging the technology to transform how care is delivered, how it is experienced, how it's financed, and how it's managed across access points and care settings. In sum, it's not about the technology so much as it is how it's used and the value that it generates. For instance, how well does it drive patient engagement? How much does it improve clinical outcomes and care coordination? How well it enhances efficiency of that care delivery model, or fosters affordability for patients or financial sustainability for those in the red. The bottom line is that digital technology is the vehicle that we help providers take to a more transformed destination. And it's a destination that positions them to better compete for patient loyalty, for talented staff, and to secure their future in an industry being disrupted like never before. So in the next section, we're going to talk a little bit more about what you can do to start or accelerate your digital transformation journey. So let's now turn to the next chapter in the presentation to do just that. We begin this chapter with a look at how we advise our clients to pursue their planning and implementation strategies for digital transformation. We like to couch these concepts. There's a lot on the page, I recognize that, but if you take nothing else away, look at both the what and the how. The what is effectively building the strategic plan and the major components as part of that. The how is the way in which that plan is executed. A few things to note here is that the vast majority of our health systems across the board are stuck in first gear, meaning that they've built a plan, but they haven't yet transitioned towards the execution of it. For those that have, it's admittedly the hardest part, I'd say. Driving change management and developing the organizational muscle memory to take your digital initiatives, get them off the ground, and set them on a path to scale. And to set expectations about how long this takes, we're looking at usually 3 to 4 months, but that process is the deliberate building of these different digital initiatives. It's the underlying requirements and mapping those out. It's building a roadmap and a business case to justify their support. That pragmatic roadmap and putting it into action is the next step of the change management process. And our experience with working with dozens of different organizations like SoNE is that that process of translating that roadmap into action is undoubtedly challenging, but crucial. And each of those components behind it on the left side of the page are absolutely critical to having a successful digital transformation journey. But with all that said, it's not just about having a good plan or a compelling roadmap. Those are necessary, but I would say insufficient by themselves to ensure success. The key things that separate digital transformation successes and failures are the following characteristics that we've built over the years of working with dozens of different organizations on their journey. The first is a shared vision and a link between the strategic objectives of the organization and the digital initiatives. Secondly is a cohesive governance structure to make decisions in a timely manner and to maintain accountability across the organization. Third is a clear set of priorities so you don't try to solve everything at once. Fourth is a consistent approach to project management across the digital initiatives. If you're going to be prioritizing certain ones, they have to have the support to succeed. Fifth is a way to measure the impact and value being generated by those initiatives. And finally, ongoing change management, perhaps the hardest part of all. That needs to be hardwired into the rollout and ongoing management of those initiatives. I'd say that lacking any one of these items will risk the entire transformation effort. And so I think it's critical to get these pieces in place, especially during the planning process. If you wait until implementation, it's simply going to be too late. And rounding out our discussion on what to do now, I recognize that many of you in the audience may be at different stages in your digital journeys. But no matter where you are in the adoption curve, I think that there's some concrete things to do to continually advance your digital transformation journey. For those that haven't started, for example, I'd recommend convening a group tasked with figuring out what you want to solve for and how to plan to do it. I'd say this is where we meet most of our clients, and we built up an incredible expertise in how to do it. For those that have pockets of digital innovation, but no formal program, I'd say that the focus should be on engaging those early adopters and figuring out what the path is towards more scalable adoption and greater infrastructure within the tech stack. And for those with a mature digital program, I'd first say, congratulations. You're among the few organizations out there on that side of the adoption curve, but I'd also say that the impact of a mature digital program should make you look beyond the boundaries of your core staff and organization to build that digital-first culture to ensure momentum across the years to come. So obviously, I'd say obviously there's a lot more detail behind each one of these different components, but hopefully you get a few ideas, possibly some guideposts as to where to take your organization next. And turning our attention now to the things I'd advise any organization to avoid on their digital transformation journey, it's really, if technology is all that's being adopted and you don't actually change your organization, those legacy issues that you've been dealing with forever and ever are not going to change either. We have an equation at Chartis that says new technology plus old organization equals costly old organization. It's basically a scientific theorem, and we have yet to find any examples to refute it. Simply said, if you don't think about the ways in which your organization needs to change to not only adopt the new technology, but to get the most out of it, you're going to be left with the capital cost of the technology and no business case to justify it. This, of course, flies in the face of the temptation to just hit the fast forward button and figuring out what the digital technology is to invest in first. But doing so is really a recipe for costly investment and little return on it. And that initial focus on the technology is one of the many pitfalls that we see derail different digital transformation efforts across the country. Too often we see provider organizations taking the ill-advised approaches within their digital strategies to first think about the technology and buy that, and then figure out what to do with it. Or even worse, when there's not any sort of consideration about how it's going to integrate with your existing technology. Second is the technology that may not be aligned with your enterprise strategic goals, or that it tries to solve too many things at once, which I think is more of a recipe for spreading your resources too thin to be effective. And finally, it's not having clear accountability for who is owning the digital initiative. That's going to make governance an absolute nightmare, and it's going to be impossible to continuously learn and improve to roll out and scale. I'd say that there's many more pitfalls to avoid than those that are on the page, but hopefully these give you a good idea about the most important ones to keep in mind, regardless of what digital initiatives you're pursuing. We'll next turn to the final chapter in the presentation today and look at artificial intelligence and the profound impact that it's expected to have in the years to come on our industry. So there's a lot of different technologies out there, and as I was thinking about preparing this last chapter of the presentation, I think that it's important to be looking at one of the most transformative technologies out there, and that is AI. It's nothing necessarily new, but I think a lot of the recent breakthroughs advance it to a tipping point where it simply can't be ignored. Quite simply, the explosion of data that so many of us here today are so familiar with has enabled such transformative technologies as AI to stoke the imagination of what it could mean for how healthcare is delivered, how personalized it can be, and what previously unreachable outcomes may soon be within our grasp. All this is because of breakthrough AI technologies that I had mentioned just a minute ago that are taking disparate, diverse data sets and processing them in highly efficient ways to develop compelling outputs to guide decision-making and even automate tasks that we've historically left in human hands. We think that these two forces, the proliferation of real-time personalized data, along with the ability to ingest, analyze, and guide action through AI, these are the two most disruptive forces in healthcare today, and frankly, it's not even close. So what does this mean for healthcare? Well, I think that it means that the opportunity costs of sitting this out will only increase in the years to come, in some cases, possibly exponentially. In our survey last year, more than half of the provider leaders recognized that that AI is very important for them to be considering in their strategic plans, but less than 10% of them had an enterprise approach to actually putting it in place. We expect that number to grow over the next year or two, and I think that that's going to be driven by a desire to reduce costs, to improve clinical outcomes, and to increase productivity. All of these intractable problems that we started our discussion with here this morning, these are the type of things that AI is being designed to tackle. But I'd say that AI is only the most recent and perhaps most promising digital tool to help address those challenges today. How to improve your financial position, how to support and extend your workforce, and how to engage and manage the health of those diverse patient populations at scale. I'd say that AI is not going to solve everything, but it's going to be increasingly an important tool to climb those mountains faster than ever before. And the promise of generative AI, applications like ChatGPT, is really what's taking the world by storm. Many of you probably have heard about the announcements from Epic or eClinicalWorks and others at Himss back in April in Chicago. They're bringing generative AI into their EMRs, and we think that's just the start to a wave of AI integrations into existing platforms that you'll soon be considering if you haven't already today. And the value proposition there is clear, assuming that the technology actually works as advertised, to drastically cut down on the documentation burden, to foster more proactive communications and engagement with patients, and to make processes like pre-authorizations, very manual, time-intensive tasks, to automate those and get clearance in minutes, not days or weeks. So all of this is really incredibly exciting, but you may be thinking to yourself, where do I start? How do I think about approaching this very disruptive and transformative technology? So luckily, we'll round out this morning's presentation with some concrete ways to jumpstart your approach to AI and not get caught behind the adoption curve on this really important technology. Among your staff, I think it's critical to engage them early to solicit their input on what the low risk, the manual, time-consuming tasks are today that prevent them from doing their jobs more efficiently. Operationally, I think it's critical to develop the organizational muscle memory on some relatively mature use cases like revenue cycle or supply chain management that have a clear ROI and can be done with your existing staff. And finally, it's crucial to organize your data to streamline the ingestion and processing within these advanced AI applications. And a key part of that process is data QA and transparency that are absolutely needed for audit and retraining the AI over time. But keep in mind that this is just a starter list, a set of low-regret strategies that we think all provider organizations should embrace to prepare themselves for the broader AI applications that are coming down the pike. And remember that AI is just a piece, albeit a really, really important one, of the overall digital transformation journey that all health systems need to be on today. So hopefully, this presentation has given you greater insight into what digital transformation is, what the journey looks like, and how to keep it moving forward in the future. Thank you to everybody for having me here today. I look forward to connecting with you throughout the rest of the day and look forward to many of the events that follow. I wanted to save a little bit of time for questions and would be happy to field them for the remainder of our time here this morning. I think we've got about 15 minutes or so.
So let me start over. Oops, I'm pretty loud. All right, so I just want to talk about patients that are older, they're not tech savvy, so everything that you're talking about is digital health. So you need to have a phone or a smartphone in front of you for these things to work. Mm-hmm. So how do you reach out to those that are maybe still have those old phones that are flip phones? Yeah. It's a small number, but the number of people that require medical attention are greater for that population. So how do you reach out to them?
Yeah, more often than not, we're seeing proactive digital deployment of technology into the home, actually setting up broadband networks. Sometimes it's LTE or 5G hotspots within the home and actually paying for it. Because more often than not, the business cases that we built around those sorts of investments, and assuming that you're not giving this out to everybody, but it's really a targeted patient population. Even among those 65 and older, the penetration of smartphone usage and broadband is still 75 to 80% in most of the country. So you're looking at a relatively small patient population that would be kind of eligible for those. And so within those sorts of investments, because of the high utilization rates, especially when you're thinking about value-based care arrangements, the ROI on those sorts of investments pay off in spades. And it's not necessarily a mobile phone per se. Oftentimes it's an iPad or tablet that have a really easy to use interface that they can then use so that they're not fumbling around trying to figure out the right app and who to call and all that sort of thing. It makes it as simple as possible. So definitely a challenge, but I see more often than not hospitals and health systems actually investing in the technology to bridge that divide. Yep.
This is a two-part question, but both related to the people.
Yep.
The first is, what are the new competencies that we need to start developing informatics professionals to be able to support this? And the second part of this is, you talk very strongly about reducing costs through the use of AI, mm-hmm. and most of us here know that the major costs of our health systems are the costs of the people. Mm-hmm. So how do we engage the people when they look at the fear of saying they're going to make this less expensive, so they're going to eliminate my job?
Right. Yeah, I think it's a common worry among a lot of different health system workforces. What I'd say is, just like any technology innovation that we've seen over the last century, it's meant to improve or replace old processes and tasks, not necessarily jobs. I think that the workforce shortages that most provider organizations are facing, they will upskill or evolve those jobs because they don't want to lose the people. It's the tasks that may be offloaded, and quite frankly, it's a lot of the time-consuming, mundane tasks that are leading to some of the burnout. When we look at the opportunity to reduce clinical documentation time, pajama time for a lot of the providers, that's one of the early use cases that Epic is looking at, for example, to automate some of the generation of communications between providers and their patients. Obviously, still having a human involved to hit the send button on those communications. But if you can reduce that time, if you can cut it in half, for example, that's more time you can spend in the clinic. On the administrative side, we're actually seeing a huge ROI on things like revenue cycle and supply chain management, automating a lot of those processes. Pre-authorization clearance is a big one right now that takes up an abundance of time. And if you can actually automate that, you can retrain your workforce to do other things that are much more creative, complex, and engaging tasks that they would otherwise be asked to do. I haven't worked with a workforce yet that isn't excited about getting rid of the mundane, repeatable tasks that make their jobs mind-numbing.
So you're over here. The opportunity to use the ability to create a plan that you did for SoNE as well as for AI is fantastic. So thank you very much for the great presentation. However, a lot of organizations don't have the ability to implement a program like you did. SoNE has the capabilities, large organizations, MGB, et cetera, do. But what about the smaller organizations or the individual providers, the 5, 10 doc practices? You know, recently a 100 doc practice in Greater Boston, Compass Medical, went out of business. They couldn't survive in this environment. There was a lot of reasons behind that, but certainly 5, 10, 20 doc practices are not going to be able to implement a lot of the solutions you've talked about, certainly the AI that you're talking about, because they don't have the capacity. They're dealing with survival. So what's the recommendation to those organizations who still want to retain some independence? They don't want to necessarily join one of the other groups, but how to take advantage of the knowledge that you've provided.
Sure. I don't think those are mutually exclusive. We've worked with a number of different smaller medical groups over the years that are trying to make their practice management a lot more efficient. The use case I was just talking about in automating at least the initial draft generation of patient communications is one that resonates with employed physicians at large health systems as well as small onesie and twosie private practices, quite frankly. I think that it's identifying the pain points and the friction places where AI can help automate or at least streamline. Those may be a little bit different based on your existing infrastructure, your support levels. I get all that. But what I'd probably say, and where a lot of the discussions are happening right now, is we are being brought in because a lot of either medical groups or health systems are having discussions with their technology vendors that are bringing AI capabilities to the fore, and they just don't know how to think about it, assess it, and figuring out if the juice is worth the squeeze. And I would say that depending on what those pain points are for the smaller practices, there may be easy, quick wins that help save them 5, 10 hours a week. And to them, that's more clinic time that they could actually have and address some of their access issues, for example. It's not as if you need to adopt every single AI application under the sun. But it is about figuring out what's going to be the highest impact and yield, and a lot more of these technology integrations with existing platforms, I think, is a good place to start. Yep.
I'm just wondering what you would say to people who have concerns about Google Translate as relates to the imprecision of the translation and the legal and the compliance and patient advocacy issues perhaps as well, in a way that it perhaps is hard to overcome.
Right. Whether it's Google Translate or some other mode, we're seeing this actually. I've worked with a number of different organizations that are integrating translation services into their telehealth programs. I was working with a program down in South Florida, for example, that had boosted it. It basically doubled its telehealth utilization among the Hispanic population down there because they offered a translatable service that allowed them to access that unlike any time before. A lot of those translation services may not be perfect, but I think that the vast majority of them are pretty good, and we haven't run into any sort of major legal hurdles to enhance the liability of the care delivery and the way in which that's communicated. Not to say that that doesn't exist, but the legal teams that have been part of the planning process, because we really do think a multidisciplinary work group is is critical to be able to do that. It's legal, it's marketing, there's obviously technology involved, there may be vendor relationships, but anytime that legal has been involved with those sorts of propositions, we haven't received or heard of any pushback or about the risks of integrating that sort of technology. I'd also say, when you're thinking about natural language processing too, there is liability risk of how that is going to be translated into the medical record. You don't need a translation service to actually, think about NLP. But I think that gets back to something that we've been talking a lot lately in our AI discussions, is that there's a different role between what I call intelligent automation and intelligent augmentation. You can automate a lot of different capabilities, especially on the administrative, supply chain, financial management, et cetera. The risk is relatively low. They're predefined, rules-based processes to address. On things like natural language processing, yes, there are a lot of different vendors out there that are basically saying we've got ambient listening technology that can think about and translate what the clinical encounter says into the EMR. What I'd probably say is that there needs to be a guardrail to check the accuracy of that. Whether it's a Google Translate on a telehealth visit or it's an NLP translation into the EMR, there has to be human involvement to make sure that that is actually accurate or not. And that's usually where the legal folks take a step back. Yep.
Come next. It's actually a good follow-on. I appreciate that your last point had to do with developing a taxonomy. I've seen many examples where natural language processing can take care of everything. We don't have to structure our data first. Wondering if and that fails. And they have to go back to step one. Can you expand on the risks of not taking the time to properly organize and prepare your data?
Yeah, so let me just back up a few slides here. I think that that's absolutely critical, right? It's not just AI, but it's digital transformation overall. More often than not, we are seeing a lack of organizational readiness in their data structure. It is, if you don't go through the arduous process of data QA, it's going to be garbage in and garbage out on the outputs that you're going to get from things like generative AI. So that's absolutely critical. The other thing I'd probably say on that front is that there are things within your data structures that you do not want AI to interpret by itself. Now, it's really interesting that ChatGPT and all these other large language models are taking petabytes of information from the internet and basically running its own machine learning on it to figure out what things mean, what the patterns are between them, and how to interpret different pieces of data to figure out what comes next. There are certain things in our data structures, especially in healthcare, that we cannot leave to machine learning interpretation. So we've been working with a number of different organizations, especially some big ones, that are focusing their primary resources, especially the data scientists that they've been able to hire recently. We're working with HCA, and they have a big partnership with Google on this front. They are focused laser-like on their data taxonomy because they are thinking to themselves, if we're going to be asking the bot to go into the EMR and develop a pre-visit clinical note, it needs to understand exactly what the different abbreviations, all the taxonomy means, and we can't afford it to misinterpret something. So be very deliberate about the taxonomy and tagging the right data structures that you don't want to leave to risk. Any other questions? I think we're coming up towards 9:30 here in a few minutes.
Any hands up that I'm not seeing?
Alrighty. Well, hey, thank you, everybody. Hope you found this to be a good presentation.